So management. Overall, patients start treatment based on initial severity of asthma symptoms, and then you go up and go down based on asthma control. So step up to improve the control, step down to find and to maintain the lowest controlling agent. So the chemistry of asthma inhalers, and I really like this slide. Yes, the days of when we could say, okay, if you're using the blue one, I know that's the albuterol, and if it's the brown one, I know that's the inhaled steroid. We can't do that anymore. There are too many other colors out there. But what's helpful about this for me is bronchodilator quick relief starts to work in about 5 to 20 minutes and lasts generally between 2 and 4 hours. So when someone says, that asthma medicine was terrible, it only lasted for 3 or 4 hours, I needed more. Well, that's exactly what you'd expect from the bronchodilators. As importantly, for the inhaled steroids, they start to work. It takes about a week for them to start to work, and it takes a full month before you get the maximal benefit. So for someone who's been on an inhaled steroid and they don't feel any better, and they're coming back a week later and saying, listen, it hasn't done a thing, you haven't given it enough time. So as far as new therapies, okay, this was just introduced, albuterol, in 1969. The early 70s, the inhaled steroids were first marketed. So I'm glad we're going to be hearing about some progress beyond these two. We have several different forms of this, which I'm going to show you in a moment. Quick relief. So what are the drugs? Albuterol, R-albuterol, ipratropium. Albuterol, R-albuterol, are they very different? So the clinical study suggesting no overlapping, overwhelming superiority one over the other. If there's a patient preference, fine, because as long as the prices are comparable. And then for ipratropium, still at this point, this is used almost exclusively in the emergency room. And this happens in any emergency room around the country. If you come in, you will be treated with a combination of albuterol and ipratropium, typically one treatment every 20 minutes, or here in this emergency room, you get one large container full and it just keeps running. You're basically doing 3 treatments in the first hour. So here, quick relief medications. Same medication, different names. So it's tricky. We actually have a photo in the clinics so people can look at it and they don't have to say, well, I think it was the orange. Just point to it. Does it look like this one, this one, and this one? And then you know, then you can link that and you'll know this is albuterol. So here they are, albuterol, 5 products. It's really one medication.